All right, folks, we've got 3 o'clock. Please proceed. Thank you.
Thanks, Paul. Good afternoon. My name is Cliff Cullen. I'm the Minister of Education. And before we begin, I do want to take a moment to thank our Chief Provincial Public Health Officer, Dr. Brent Roussin, and our Deputy Minister of Education, Dana Rudy, for joining us on the call today. I do want to thank all teachers, school staff, school leaders, school divisions, parents, and caregivers for their dedication to the students of Manitoba. I do want to thank teachers for the return to school this week during our phased-in approach. Looking forward to having a successful completion of the remainder of the year. Manitoba education and public health have shifted over the last 2 years to ensure students remain safe in and out of the classroom. And today, we will be announcing another shift to contact tracing and case management based on recommendations by public health. We know that Omicron variant is different. We are dealing with a different virus. This means we must shift the way we case manage and contact tracing occurs. I'll now invite Manitoba's Chief Public Health Officer, Dr. Brent Roussin, to explain further.
Thank you, Minister. Afternoon, everyone. Brent Roussin, Manitoba's Chief Provincial Public Health Officer. So the emergence of the Omicron variant has changed the way we respond to COVID-19. This variant is much more transmissible than the other strains. It has a shorter incubation period, so it's really forced us to change the way we approach it. For every one person infected with virus in the past, we would think 3 or 4 people might be infected with the Delta variant. With Omicron, that is multiple times greater. Many people have only mild symptoms and some with no symptoms at all, which increases the chances of being exposed to this virus over time. So we know COVID is here with us. It's going to be here with us for the foreseeable future. And so we have to not consider that we're going to eliminate this virus. We need to find ways to mitigate our risk related to this virus. So it's very likely that a very large proportion of our population will be exposed to this virus in the coming weeks. We have to adapt to working, learning, living with COVID that is circulating in our communities at this point. So again, given that transmissibility of Omicron, given the shorter incubation period, it's not possible to manage cases at that individual level anymore. We have to focus on managing the risk at the community level. So this is not giving up on dealing with Omicron or COVID-19. Because this virus has changed significantly, we have to change our approach significantly. And that's what we've done. And we're shifting that approach from that individual case management to more of that management of the risk. So just going through some of our data to look at that, what that risk is in our school-age children. And we know that the risk is relatively low for most children. There were 6,703 cases of COVID-19 among children 0 to 18 between December 1, 2021 and January 10, 2022. Among these, 46 children, or 0.7% of cases, were admitted to hospital. Among those cases, 31, or 2/3, were admitted to hospital for other reasons. This means that 15 were admitted to hospital either due to COVID-19 or because they had a condition that was made worse by COVID-19. The rate of admission due to COVID-19 or because of a condition made worse by COVID-19 was 0.58% of children aged 0 to 4, or 7 out of 1,203. The rate of admission due to COVID-19 or because of a condition made worse by COVID-19 was 0.18% of children aged 5 to 11, or 5 of 2,766. The rate of admission due to COVID-19 or because of a condition made worse by COVID-19 was 0.11% of children aged 12 to 18, or 3 of 2,734 in that age group. And so while hospital admissions may be increasing, the proportion of cases that get hospitalized has been stable throughout this pandemic. It has remained about 0.8% of all cases among 0 to 18-year-olds for all admissions. And so again, we're providing this information not to downplay the strain on the acute care system and the importance of Omicron, but we're providing this to put this in the context of risk. And that's really what our focus is now, is mitigating risk. So this data tells us that in general, the risk for children is relatively low. And so we also need to weigh what are the benefits of having these children in school, in-person learning. And we know that that's very large. There's a huge benefit to having kids in class learning. So this is connecting with others socially. This supports their mental health, regular physical activity. Schools are important places for safety and nourishment for many children. Young people benefit from that structure in their day, the regular learning, which they may not get in remote learning. So again, here that benefit is outweighing the risk. And so this means adjusting again our mindset from trying to eliminate this virus to trying to mitigate our risk related to the virus. So we recognize some families may have individuals who are at higher risk in their household and may be worried about their children being exposed at school. So again, if you're at higher risk, you need to be fully vaccinated. Get whatever vaccine dose that you are eligible for as soon as possible. People who are higher risk, if you have symptoms, even if mild, we want you tested as soon as possible, because now we have some treatment options available. So these are ways that you can further mitigate that risk. So you know that we've changed the way our testing processes and case and contact management are occurring in the community. And so now we're recommending these changes to how cases are managed in schools. Again, it's the nature of Omicron which has forced us to change the way we approach Omicron. So moving forward, schools will no longer provide close contact notification and notification letters on individual cases. Again, like we said, the nature of Omicron doesn't allow us to manage this on an individual basis. And so we know that many cases won't be identified if they don't have symptoms or not tested, or if they test with a rapid test, that may not be reported as well. So schools are going to provide regular reports about absenteeism through their regular notification channels to their school community. Parents must continue monitoring their children for symptoms. If any symptoms develop, that child should isolate and seek testing. If they test positive, families should isolate according to the public health orders. Schools will monitor staff and student absenteeism rates and self-reported COVID-19 cases. Public health will continue to report confirmed cases through the online dashboard and monitor confirmed cases in school for evidence of increased transmission above levels expected in the community. When there is an increase in COVID-19 activity based on absenteeism, case counts, or operational concerns, public health will investigate and provide recommendations to school officials. Again, we're not giving up on mitigating the risks of this virus. We're just changing the way we have to deal with this virus. In situations where public health determines increased transmission may be occurring in a school, they may recommend the implementation of a period of rapid antigen testing or other preventive measures in the school, such as reducing higher risk activities. When transmission continues to increase or where COVID-19 cases are affecting school operations, a 7-day period of remote learning for the class, cohort, or even school may be recommended by public health. This will be done on an individual class or school level rather than a community or divisional level. And this is, again, it's better to have this short remote learning period that affects the smallest number of kids rather than a blanket remote learning period affecting all kids, because we know the benefits of having those kids in school. Students or staff who test positive on a PCR test, rapid antigen test, or suspect that they have COVID to follow public health isolation protocols and are strongly encouraged to notify the school. School staff and students should also attend a test site if they have signs and symptoms of COVID-19. If they test positive on a rapid antigen test, they're encouraged to go for a confirmatory PCR test, lab-based test to report to public health, and that'll still allow public health to monitor cases in school. Students and staff who are exposed at school can continue to attend as long as they're asymptomatic. Household close contacts who are exempt from isolation but have a case in their household are encouraged to use rapid tests to monitor for asymptomatic transmission, as that household contact still remains the highest risk setting for transmission. So as I mentioned before, confirmed cases will continue to be reported on the dashboard at this time. It's important to remember that this data will be an underreport of cases for a lot of reasons, mostly because of our testing regime changes. So not all cases will be identified, and we know with how Omicron is spread, we identify a small proportion of overall cases. These changes, they're leveraging the local knowledge of school division and school principals. They ensure that each school is monitoring the spread of the virus and adjusting measures as required. They make the decision to move to remote learning to address operational leads. With wide community transmission, we certainly expect to see cases in schools. We need to expect that. We need to manage our risk, not eliminate it. Because COVID-19 is circulating everywhere, we need families to continue to support schools. For every case we know about, there'll be cases that we don't know about. That's just the nature of this virus. If you hear there's a case in your child's classroom, you need to monitor for symptoms and isolate your child if they develop symptoms. And the same holds true if you're not aware of a case in your child's classroom. You still need to monitor closely for symptoms and isolate if symptoms develop. So that advice remains the same. So self-monitor for symptoms, seek testing if they develop, and isolate until you recover. So we still learn more about this virus and its severity, and we'll continue to review the data as we learn more. And as we learn more, we'll adjust our approaches to identify those most at risk and again, to mitigate the risk of COVID-19. We're not going to eliminate it. I know this may feel like a sudden shift in our approach. It may feel like everything we've done in the last 2 years was in vain, and it's unsettling and unnerving to some. But again, the virus has changed dramatically, so we need to change our approach dramatically. So today we're in a much different place than we were 2 years ago. We have vaccines and some treatments now available. And we've all learned over these years on how we can reduce our risks. So I want to thank Manitobans who have sacrificed so much during these past 2 years. We did what we needed you to do. And we're asking, again, for all of us to work together to mitigate the risks of Omicron. You stayed home, you got vaccinated, you protect yourself and others. And we haven't given up, and neither should you. We still have public health restrictions in place. Public health has focused a lot of efforts on vaccination. There's treatments available now. We've introduced new testing options to help control the environment in schools. Teachers are being provided with medical grade masks. But we know we can't let this virus overwhelm the healthcare system. So a lot of work is underway to prepare the system for the expected surge in cases. But we also need to manage our own risks as best we can. And one of the best ways at that prevention is to get vaccinated. Get whatever dose, 1, 2, or 3 that you're eligible with as soon as possible. Get tested if you have symptoms, especially if you're at high risk. Most importantly, stay home when you're ill. If you're at high risk, get tested early because there are some treatments available now. Wear a properly fitted mask when you're in public. Still have that physical distancing. All these things are still part of the effective layers of protection we have against this virus. So again, thanks to all Manitobans. Thanks to our parents who have worked so hard to keep their kids safe during this time, and thanks to our educational staff. It's so much appreciated during these challenging times. So thank you, and we'll happy to open up some questions.
Thank you,
Thank you.
Doctor. Thank you, Minister. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Maggie.
Hello all, Dr. Roussin. I'm hoping this question is for you. I'm trying to make sense here of why the province is now discouraging close contact and community letters from schools, given both high parent anxiety levels as well as the fact that parents simply won't know about these cases. And the messaging is, if you know about a close contact in your school, you should review and self-monitor for symptoms. So can you explain why we're abandoning those community and close contact letters?
Yeah, so again, it's need to not frame this as abandoning anything. It's shifting our approach. So Omicron is so highly infectious, has a shorter incubation period that by the time you do these contact tracing, many of the contacts could already be symptomatic. So it's again our approach to it that we have to monitor those symptoms closely. If any symptoms develop, get tested, isolate. If you know of a case in school, watch for those symptoms very closely and isolate if they develop. If you don't know about a case in a school, watch for those symptoms very closely, isolate if they develop.
Why not continue doing this even just simply for the sake of transparency and because anxiety levels are so high among families right now?
Well, we're going to, as far as transparency goes, we're still having that dashboard that we're reporting on. So public health is still heavily involved. We're still going to be in close contact with all the education institutions. We're still reporting publicly on that dashboard. Again, we're adjusting our approach to what's going to be most effective to mitigate our risks against this virus.
Thank you, Doctor. I believe your moderator may have misspoke. Minister, do you have a few more comments?
Thanks, Paul. Actually, I do have a few more comments. Hopefully this can add some insight into where we are in this journey. Thank you, Dr. Roussin, for your comments. I'd say this update on contact tracing and case management really ensures that public health is able to monitor the risk in individual schools and target measures to lower transmission. We know that students learn best in the classroom, and those benefits can't be understated. From mental and physical health to socialization and support for families. Schools and school divisions have done a tremendous amount of work to help reduce the spread of the virus and protect our children and staff. Manitoba Education has full confidence in our school divisions. We have provided our school divisions guidance on ventilation and how to protect those students from COVID-19, including mask use, enhanced cleaning measures, updated physical distancing requirements, and expanded efforts to decrease congestion in the school through operational plans. Our government has provided investments on a per pupil basis that allow school divisions to determine how to best utilize these funds to ensure that schools are safe for students and staff. This year alone, this investment in a COVID response has amounted to over $330 per student. We are confident that school divisions know their schools best and have implemented all guidance to ensure that students are protected. Our government has also made continuous investments to protect students as they get ready to return to full this Monday. This includes rapid testing programs for asymptomatic teachers, staff, and kindergarten to grade 12 students who are experiencing high case numbers or high absenteeism. We've provided $6 million for medical masks to meet Health Canada performance, as well as other personal protective equipment. We will be supplying an additional 5 million masks to the school system in the coming months. We have provided $6.8 million to improve ventilation, a total of 210 projects in 176 schools have been approved. This includes over 200 short-term operating improvements related to air purification, including air purification filters, units, and other systems. $1 million in additional funding towards mental health and supports for students and staff. All of these investments have added $200 million to the K-12 school system in this year. This represents $63 million on COVID, $46 million in the property tax offset grant, $13 million to cover the increased contribution to the Teachers' Retirement Allowances Fund, and an additional $80 million to assist with incremental wage costs and other pressures related to COVID-19. Again, thank you to all teachers, school staff, school leaders, school divisions, parents, and caregivers. I'm now prepared to take further questions. Thank you.
Thank you, Minister. Up next from Global, Rosanna.
Hi there. Some of these changes you're announcing today, like the rapid testing program, these are happening as of Monday, I'm guessing. And what threshold of cases would warrant a move to that 1 week of online learning? Like what rate of absenteeism?
So we purposely didn't set a single rate that we were going to be tied to. We're going to look at the overall picture in that school, the rate of progression of absenteeism, and so public health will be heavily involved with the schools to decide on the nature of the transmission, what's going to be that best approach. Certainly, that move to remote learning, even though it's short term, that's going to be that sort of the last step in that. We're going to do whatever we can to keep as many kids in school as possible.
Thank you. And at this point, just given the spread of Omicron, when children head back to school, is there any gauge on what % attendance will be?
No, I don't think I would, speculate on that. I think we know for sure we're going to see absenteeism, and that's part of the reason we don't just set a sort of that arbitrary number of when we're going to act. We want to see what baseline develops, changes over time. So we need to expect to see absenteeism moving forward.
From the Brandon Sun, Kyle.
Good afternoon. My question's for Minister Cullen. You said during your announcement that it's up to the schools really to determine what's best for its students and staff currently, but that's kind of runs contrary to what you and your government were saying once you were pushing Bill 64. So I'm kind of wondering, is it just Omicron that's caused you guys to change your tune, or has this been have you guys changed your mind about that approach a while ago?
No, I think it's pretty clear. We've new leadership here with a new premier in place, and we've taken the collective decision as cabinet, as government. The Bill 64 is now behind us. We're moving forward in a collaborative approach to dealing with K-12 education here in Manitoba. And we value the great working relationship that we're going to build on with our stakeholders. And clearly, as a government, we provide sort of the direction, if you will, the operational component to dealing with K-12, and how we deal with COVID is up to the respective school divisions. We want to make sure that they have the resources to make sure that students and staff are safe and provide as much guidance and assistance as we can during this process.
All right, thank you. And I received a call today from someone who said that in terms of school staff, public health is advising that they should be wearing medical masks, including N5 masks, but this notice apparently said that KN5 masks should not be worn. So I'm wondering if that's true, and number two, why is this distinction being made if it is true?
I'm not sure exactly what this what you're referencing there, but we were talking about medical grade masks. We want for staff to use, and certainly that's a layer of protection again with on top of everything else. We're not recommending N95s in this scenario. There are certain specific circumstances in the healthcare industry where we are recommending the N95s. But the medical grade masks is what we're recommending.
From CJOB, Clay.
Yeah, hi there. When it comes to this coming Monday, is it the divisions who decide what's the best way to space kids apart, or has a directive come down from public health on that?
So they are at orange on the PRS of schools. So there's still a requirement there to do whatever they can to have that that spacing there. I wonder if Deputy Minister has more specifics on on that.
Sure. So yeah, I think what we've decided in partnership with our school divisions and independent schools is that they know best in terms of how to space kids to the greatest extent possible. So the guidance looks at in trying to ensure 2 meters of physical distancing to the greatest extent possible. And then schools can use a variety of different methods, like different spaces and rooms, to be able to achieve that. And so it's not going to look the same in every school. It depends on the number of students, the number of classrooms, the number of unique spaces that they have available to them. So schools will be best positioned to make the decisions around how to space. And again, for most of last year, most of our schools were operating at a restricted level orange. And so they've had good experience with finding creative ways of continuing learning during this this time of higher transmission.
Thank you. Also, I've been asked to get an update this coming Monday. Will there be any changes for gym class or school bands, choirs, or does that stay the way it was or is?
Maybe refer that question to Deputy Rudy.
Yeah, so for the most part, we're going to be continuing to focus on curricular areas, so including physical education. Extracurricular activities can be permitted. Tournaments are suspended, obviously, just during this peak period of time. And overnight trips are no longer allowed under the current public health orders. So we see our children in K to 6 being asked to stay within their cohort. And so the idea would be any extracurricular activities would be working within their cohort. And then spectators should be restricted for any extracurricular activities that are occurring at the school level.
From the Winnipeg Sun, Ryan.
Hi, I guess this is a question for Minister Cullen. Just in regards to the upgrades you've announced for schools, the province has thrown a lot of dollar amounts around. Just wondering, have you been to a school to see what's actually been done? I'm hearing from a lot of teachers that, specifically in the Winnipeg School Division, that there's been no upgrades to the ventilation system. And some schools are even asking teachers to open windows as a way to increase ventilation.
Yeah, this whole the concept of ventilation and HVAC systems, we do allocate capital each and every year. I think this year alone is about $20 million out of our $160 million of capital that went into upgrading ventilation systems across the 800 schools we have in Manitoba. We just recently announced $6.8 million for ventilation. We've just approved, I think it was over 200 projects in 176 schools. We know the money is going out the door, and work on those projects will be taking place very soon.
Okay, do you know offhand how many schools specifically have received ventilation upgrades?
There's 176 schools, 210 projects were just recently approved. So those programs will be rolling out here in the next few months.
From CBC Manitoba, Ian.
Good afternoon. Is there an expectation for individual schools or teachers in classrooms to do some level of contact tracing? You note that we're no longer getting letters out, but is there a request or a want that someone else will do that alerting of COVID cases?
You know, again, the nature of Omicron decreases the usefulness of contact tracing at that individual level. So we still want everyone watching for symptoms very closely, isolating if they develop, testing if they develop, and then if they do test positive, whether that's through PCR or through rapid testing, then to notify the school, because at that class level and school level, we will be looking at the rate of infection. Public health will be looking towards that, but dealing with this at an individual contact tracing level, it's just Omicron has really limited our the usefulness of that.
Okay, and I'll take that to assume, not just contact tracing, but even just identifying cases. My follow-up question, though, Dr. Roussin, is that we had the Premier say yesterday that in the past we focused too much on the advice of public health and not enough on hearing from other voices like businesses. When you hear that, what do you say? Do you think we focus too much on public health?
Yeah, I'm not sure if I heard that, but I think the message is that these are large societal level decisions on these restrictions that have impacts on health in many aspects. So I think that decision makers hear advice from multiple stakeholders. Public health provides advice continuously in many formats, and it's always been considered, in my opinion.
From the Canadian Press, Steve.
Hi there. Further to Ian's question, Dr. Roussin, did you recommend more stringent public health measures last week before the decision was announced to continue with the status quo?
So again, this is kind of what's addressed yesterday. Public health, we've been providing advice to government continuously throughout this pandemic. That advice takes many forms, many scenarios, and so we certainly provide advice. The specifics of what is presented is obviously privileged, but we always have been considered, and I think public health has been able to provide the advice it sees fit.
And I'm limited to 2 questions here. So my next one is for the minister. Mr. Cullen, we're hearing from quite a few parents and teachers that say, well, a lot of these ventilation projects aren't done yet. There's still very limited ability in some schools to ensure 2 meters of distance. And the order is as much as possible, but there are many cases where that's not possible. So what do you say to parents, teachers, and staff who say, well, the current situation, given the limits on ventilation, given the limits that we can't expand a classroom and we have 25 kids in it, they're worried that it's not safe given the transmissibility of Omicron?
Yeah, I think the conversation this week is really pivoted to how do we manage risk. It comes to the point that we have to deal, we have to live with COVID, whatever variant we find ourselves in. And I think that's really the discussion. We recognize how important it is to have our students in class for learning, for their mental health and their well-being. And this has been highlighted time and time again. And this is what we're driving for. We're doing everything we can to try to mitigate that risk. That's why we've been investing in ventilation systems as well. Certainly the masking and keeping those basics are fundamentals. Cleaning procedures will be enhanced in schools. Again, we're trying to make sure that we're doing everything we can to provide as safe of an environment as possible. So I would say to parents, I know some parents feel there is risk. We're trying to mitigate this risk as much as possible, working closely with our stakeholders in the sector. So this is critical going forward. I would say to parents, please, if you're feeling uncomfortable, have a discussion with your teacher and make sure that you understand what's going on in the schoolroom. I think that's really critical that we have those dialogues.
From CTV Winnipeg, Jeff.
Oh, hi, Dr. Rusin. I've also heard from parents who said, you know, I'm leery to send my kid back to school because they're not eligible quite yet for their second dose. Boosters will be down the road, I'm sure. What do you want to say to them? Because some parents have kids with one dose, some parents have kids with no dose. What do you want to say to them who are worried their children are not fully vaccinated, 5 to 11?
Yeah, so I think the message is for the most part, get vaccinated with whatever dose you're eligible for as soon as you become eligible for it. We still recommend, as you heard from Dr. Reimer yesterday, that 8 weeks duration for that second dose in that age cohort. For the most part, people can consider their own risk tolerance if they wanted to shorten that interval. Again, the single dose does provide some protection. We know that the risk in these age cohorts is relatively lower than other populations. And so again, it's about those layers of protection. So do get any dose of vaccine that you're eligible for. We want the most people in those classrooms now having 1 or 2 doses, wearing the mask. We have other things in place now. So it's just a multiple layers of protection. So again, everyone can do their own sort of risk assessment, but my advice would be to, for the most part, stick to that 8 weeks for that second shot.
And I just had a question, Dr. Rusin, on our COVID mortality rate. It seems to be higher than our neighbors. Can you pinpoint why, or any reasons why that might be?
No, I don't have any specifics on that. These are things we'll have to be looking at over time and analyzing those cases, the way other jurisdictions report it compared to us. These are all things we need to consider.
From CBC National News, Cameron.
Good afternoon, for Minister Cullen. We know we don't have as many rapid access tests in Manitoba as some of our neighbors do. Given the insatiable demand around the country, are you confident we'll have enough tests to get us through to the end of the school year, 500,000 that you've identified? Many people have started using those already before school's even begun.
Yeah, thanks for the question. Before I get into that question too, I should, just going back to a previous question, Public Health will still show the dashboard on their website. So again, people that have tested positive for the PCR test, those numbers will show in respect of the individual schools. So those numbers will still be available. As far as the test kits, you're exactly right. Certainly a lot of peak demand for these test kits. Supply is certainly questionable. I know the Premier's reached out to the Prime Minister to make sure that Manitoba does get our fair share of test kits. Clearly, when it comes to K-12 education, we've got 500,000 kits out there now. We're looking at sending out an additional 200,000 in the coming weeks. And again, we're using the test kits on a more targeted approach going forward. So when we recognize that there's increased transmission in a given school or community, we can prioritize testing to that particular school. So a real targeted approach, especially given the relatively tight supply of those test kits.
And to follow up on that, if I'm reading the press release right, rapid testing program for asymptomatic teachers, staff, K-12 students in schools, who would actually, in times of absenteeism or high case numbers, who would actually be conducting those tests? Would a teacher be put in a situation where they have to conduct the test, say on a grade 3 student?
I don't know who's best to answer that one.
Yeah, no, there we would be distributing the rapid tests as we have been now. So it would be self-testing.
So who administers the test on a child though, or assists the child?
That'd be done at home.
So it would not be done in the school?
That's correct. We'd be distributing the tests as you would at, say, a testing site now.
All right, folks, we have time for a couple more questions. Media, please proceed.
Dr. Russin, you must have some baseline when it comes to high absenteeism and high rates of cases in schools. Is there any, like 10%? When are schools going to be looking at their own population and thinking this is getting questionable? It's high absenteeism. Is it 10%, 30%?
Yeah, so we're going to be in constant dialogue with each of the schools, seeing what that absenteeism rate is over time, changes over time. So again, we don't want to mention a specific target because that it could look different for different schools, could look different if we see a different trajectory in that school. So I think we all know that other jurisdictions have mentioned 30%, and certainly that's a high level of absenteeism. But we're not going to have just a single target that we go to. We're going to be looking at the whole situation.
The news release, Dr. Russin says that if there's lots of cases, lots of absences, public health will make recommendations to schools. So that doesn't mean that, or it doesn't seem like closing schools for remote learning is the first option. What could those other recommendations look like?
Well, again, so for the most part, the things that we've outlined here today is, increased access to rapid testing, maybe that option. Again, we're going to look at the specifics of what we think the transmission, where it's what's occurring in that school, make recommendations based on that. And so, absolutely, the last thing we want to do is take large amount of kids out of school. For this, we know there's going to be a lot of absenteeism because of the nature of this virus, but going on remote learning for large cohorts is going to be sort of that last case scenario.
Minister Cullen, there are students, high school students, planning to walk out on Monday in at least 6 schools. They're asking for rapid tests. They're asking for masks. They're asking for the option to have remote learning if they want it. What do you say to these students who are planning to walk out?
Well, we've been taking advice from pediatricians across the province, and they highlight the importance of having students in class for their own well-being and mental health. Clearly, educators have told us students learn best when they're in the classroom face-to-face with the teacher. Highly recommend those individuals have a second thought about this, have the discussion with your parents, caregivers, and reach out to the individual teachers as well, just to make sure that you fully understand and appreciate all the precautions that have been taken in the schools. Certainly, we made rapid tests available as much as we can. We're providing another 5 million masks going out to schools over the coming months. So that'll be over 12.5 million total. And I think we're taking everything, as many precautions as we can to really try to mitigate this risk as we have to work with COVID. I mean, we've got to get back to some form of normalcy, or whatever that may look like.
Dr. Russin, since public health is moving to mitigation and now relying on vaccination to get people out of the hospital, will you make third doses a requirement for educators and for other fully vaccinated people who work in the public sector, given immunity wanes after 6 months?
So definitely vaccine is the best protection that we have against severe outcomes. So the message is, get whatever dose of vaccine you're eligible for as soon as possible. At this point, we don't have plans on mandating the third dose.
Time for a couple more questions, folks.
Deputy Minister Rudy, I'm wondering if you can explain why the province recently updated Code Orange and Code Red in that handbook for schools without making those changes known publicly, because this Code Orange that is in schools looks very different than the one that was in place last fall. And I don't think a lot of families or school staff even know about this change.
Yeah, a lot of the specifics with the orange have been in place for much of last year. So we haven't really deviated tremendously from what orange and restricted level looked last year. What I would say is that we are working on a package of information that will be circulated very soon out to schools and to be able to really explain what additional measures will look like and what kind of letters will be forthcoming from the schools as transmission is identified, as rapid tests are being utilized, and then obviously in the eventuality that remote learning is necessary. So there's a series of information that will be going out to families. We have communicated and worked closely with schools around what orange will look like throughout all of last year. And so as additional measures have been needed, we haven't hesitated to add them or adjust them and change them. And I think we do that in response to what the virus looks like, and as the virus changes, so do our measures.
For household close contacts, Dr. Russin, the news release says that, those people who are exempt from isolation, so I guess that would be vaccinated people, that if they have a case in their household, they're encouraged to use rapid tests. So are they now permitted, or are family members permitted to get rapid tests and get that access?
So yeah, so on this fact with the schools trying to mitigate that risk, we do want to limit the amount of testing that goes on in the community in general, as far as asymptomatic testing, but close household contacts within schools, this is an exception to that, where that higher risk exposure does warrant regular testing if you have access to that.
Thanks, everyone. This concludes our Zoom session.